Dr. Victoria Falcone, Medical Director of Physician Body Solutions. We're the premier provider of Smart Lipo and BodyJet Liposuction within the Delaware Valley, having been the first to perform both Smart Lipo and BodyJet Liposuction. BodyJet is a revolutionary new technique using a water jet stream to dislodge fat cells from surrounding connective tissue, allowing us to gently remove it from the body. The BodyJet is so gentle that we're actually able to use the fat to transfer to other parts of the body, like the face, the hands, and the buttocks. It truly is a new and exciting technique in terms of liposculpting the body. This is our patient Phil. We are going to take some fat out of his back and use it for transferring to his nasolabial folds on his face. So first we're going to numb the area. I'm going to numb the area with water jet. And you can see when I push on the pedal, it releases a spray of fluid. That's what's going to be used to numb his back area.
I'll calm down.
Phil, what do you feel?
I feel pinching.
Okay, on a scale of 1 to 10, how does it feel?
It feels probably about a 4.
Okay. So I just finished infiltrating Phil's areas with the numbing fluid, and you notice they're not overly distended. That's one of the advantages of BodyJet. The area doesn't get distended with fluid, and it allows us to see and predict our end result much quicker. Yeah. So notice we're starting to take out Phil's fat. We've been doing this procedure about 10 minutes now. We already numbed him up with a little bit of fluid, and now you can see the nice yellow fat coming out of the area. This fat will be used to transfer to his face. Okay.
Perfect. Perfect.
Notice how pure the fat is, how little blood there is. It's pure yellow.
It's 90% vital.
Go to Geno's after this, huh?
I don't think you're done with Geno's. I saw the last report from your cardiologist. You're done with Geno's. No more weight gains. Done with that.
There's a mesh filter in the lipo collector that prevents the fat from being evacuated into the suction canal. That fat is going to be collected and used for immediate re-injection.
Finished taking fat out of this area. You can see how thin the skin is, and this is his end result. It's already apparent. The skin is not distended. You can see how flat it is. Now I'm going to finish the lower back, but I wanted to harvest all the fat from this region, and now I'll finish contouring the back. The entire procedure took about 30 minutes. So Michelle is now taking the fat out of the lipo collector that we're going to use for the fat transfer procedure, and you'll see how yellow it is. And there's really no blood. It's a really viable fat tissue. Michelle, you just want to turn that up and show everybody what it looks like? Okay, so that will be used to transfer to his face. And now Michelle will transfer that fat to smaller syringes that we'll use for injection. Phil wanted to have some fat transferred to his nasolabial fold and his marionette line here. So what we did was we put a little bit of anesthetic here, where you can see that white area, and a tiny bit down here, and we infused about 3 cc's of fat into these regions to help restore and revolumize these lines. You can see on this side we haven't done the procedure yet, and the difference between this side and this side. So now we're going to do the left side of his face. Hold on for a second. Michelle, I just need the anesthetic.